Hi, I am Dr. Gupta, the Medical Director of the Diabetes Hypertension Center. We've been getting a series of testimonials from people that have volunteered to come and talk about their experience. I have a gentleman here now, and I would like you to introduce your name and tell us how you found out about us.
Yes, my name is David. I've moved to this area approximately 3 years ago, and I needed to find a doctor. So I decided to look through the yellow pages, and he has little symbols with his different things that he heals, and I had numerous. Out of the 4 things he works on, I had 3. So I decided to try to get him as a doctor. And I've come here not knowing much about doctors or the medicine or the illness that I've had, and it was amazing how far I've came in the 2 years that I've been here. I had my last doctor for over 20 years, and I didn't get anywhere. So that's about as far as I can remember. I mean, this is where I came, and I've improved greatly on numerous issues between leg ulcers and hypertension and my obesity. Slowly, it's getting where I want it to be.
Let's talk about your leg ulcer, because I've always been interested in leg ulcers, and this year there will be 125,000 amputations done in the United States in people with diabetes, and in the last 22 years I've not had one. But you've had a lot of problems, and you've gone to many centers and seen many physicians. And since you've come in, how's your experience been about the management of your leg ulcer?
Well, I've been to wound care centers, hyperbaric centers, different numerous cardiovascular doctors over the years that I've been suffering with my illness, and I have come here, and I have not had an ulcer within the last 7 months. The ulcer numerously, it was deep, and I've come here, and I was always kind of like afraid to go to a doctor, and he makes it comfortable. He makes it bearable to come and get the help that I need. I am just shocked at how fast that he heals them up, and they stay away as long as you follow his 5 rules. And the clinic that he has, the diabetes support groups that we go to, and I even bring my children here because they learn. I learn more about my disease than I've learned in years with other doctors. I've learned in months. Just amazing.
What has your leg ulcer done in the last 8 months or a year?
I've not come back. No pain. Doesn't hurt. I mean, I had ulcers where I've gotten different cellular disease and where I was ended up in hospital on IV where I almost died, and I have not had it back. Thank God.
How are you doing with your diabetes and high blood pressure and obesity now?
Well, at first I thought it was kind of strange to get all these different medicines because I was never one for pills, and my last doctor, he never gave me any pills. But I feel great. My blood pressures could be a little better. It's getting there. But my sugar from where it was to where it's at now, I mean, I'm starting to say hooray when I hit 90. It's like amazing.
How much weight have you lost?
Over 75 pounds.
And this is how?
Following his rules. Drink water, exercise, move around. Now that I'm not in pain, it's easier to walk. I couldn't walk into Walmart. I make as far as Walmart and have to sit down. Now I'm finding myself making it halfway through Walmart or all the way through. You don't realize how hard it is when you can't walk and to go to a store or go anywhere. And I'm not one to jump in a wheelchair. It's just it feels to me I'm kind of embarrassed, but I can walk. I mean, that's the biggest thing. I mean, that's given me more back to my life than being stuck in a room or in a bed, because there was times I was stuck in bed for months because of my ulcers.
It's interesting you brought up the topic of the diabetes support group. Tell us how the diabetes support group, you've been a regular visitor to the diabetes support group. How has that helped you at all? Do you think it's beneficial for the patients?
Beneficial, greatly. I've been to a couple other different support groups, but this one here seems to be the best. It doesn't just focus on diabetes. It's all the issues. It's different things. It's how to pick meters, how to find insurance, how to exercise. There's just more than just being diabetes. It's the whole package. It's not just fixing one thing. It's fixing all of everything.
Well, thank you very much. You know that at the Diabetes Center, one of our goals is to provide a better way so that you have a better health and a better life. And I hope we continue to provide that. And thank you for taking the time to come and say your words.
Thank you.
Thank you very much.
And it's always been great.